The Kenya Women Parliamentary Association, KEWOPA, is now seeking to criminalize violence meted on women during pregnancy, childbirth and after childbirth. Githunguri MP Gathoni Muchomba has presented a motion to the National Assembly that seeks to amend health-related laws to make it an offence to abuse women during the process of childbearing and offer stiffer penalties for those found culpable of engaging in obstetric violence. Brenda Wanga reports.
When Abigail went to deliver her baby at a health facility, she did not expect to be forced into delivery via cesarean section. She had indeed planned and prepared for a natural birth.
And then they tell you your baby will die because you don't sign that paper. You will sign 1,000,000 papers because you want your baby. And they pushed me to a corner so badly, and I was personally, and they made me feel I was the only one remaining between me and holding my baby.
She had just undergone what is now being described as a form of obstetric violence manifested as forced procedures. Obstetric violence is a form of gender-based violence exercised by those in charge of healthcare for pregnant persons accessing services during pregnancy, childbirth and postpartum. In Kenya, a survey conducted by the Kenya National Commission on Human Rights indicates that 20% of women have undergone this kind of violence that manifests through non-confidential care at 8.5%, non-dignified care at 12%, neglect or abandonment at 14.3%, non-consensual care at 4.3%, physical abuse at 4.2%, and detainment at healthcare facilities after birth at 8.1%.
You know, most of these times when these things happen to us, we don't even know that it's a violence against women. We just think it's something that is happening to all of us. And so I'm also joining my colleagues to say maybe the numbers that we have there is not the right numbers.
OBV is physical and verbal violence. We have had very serious verbal abuses. Personally, I'm a victim, and I know so many women here will confess that they have been verbally abused during labor or during childbirth.
Let's not limit violence to physical assault. There may be utterances that we utter to people that cause more harm than even the physical attack that we do.
Obstetric violence is said to be facilitated largely by doctors, nurses, midwives, spouses, the general public, the media, and the hospital support staff. However, medical practitioners say they aren't entirely to blame for the cases of OBV.
Let's also look at the context of the environment. If I am 3-4 nurses with 20, 30 patients, can I really optimize the kind of care I would provide? It's highly unlikely. And yet everyone is looking for individualized care.
But to come out with the legal framework, come up with the ways of how data is going to be collected, and to call upon all the women leaders, both at parliament and executive, that this is an issue that is right within our homes.
The movement to address this form of violence is expected to culminate in stiffer penalties for those who are found to have facilitated the violation of women at their most vulnerable. Brenda Wanga, Citizen TV.